Dear student, good morning. I like to highlight today one of the most important 5-star topics. This is called hereditary hemoglobin disorders. That is genetic disease of the hemoglobin. Remember this one. First of all, I have to show you how to hemoglobin synthesis in our body. Already I told previous class. Is it? Hemoglobin is synthesized mainly from the Krebs cycle, from the acetic acid. Acetic acid converted into succinyl-CoA. 2 molecular succinyl-CoA and 2 molecular glycine will form one pyrrole ring. Then 4 pyrrole ring constitute photoporphyrin 9. This photoporphyrin 9 again binds with ferrous iron, then produces heme. The heme is binds with polypeptide chain. This is called then form hemoglobin chain. There is several types of hemoglobin chain: alpha chain, beta chain, gamma chain, delta chain. Remember this one. There are 4 types of hemoglobin chain, but there are 3 types of hemoglobin. Remember this one. One is adult hemoglobin, which is 97%. Another one is hemoglobin 2. It is constitute 2 to 3%. Another one is fetal hemoglobin. It constitutes less than 0.5%. Remember this one. And the adult hemoglobin is maybe we writing in shorthand 2 alpha chain and 2 beta chain. 2 alpha chain and 2 beta chain constitute hemoglobin adult, and 2 alpha chain, 2 delta chain constitute hemoglobin A2, and 2 alpha chain, 2 gamma chain constitute fetal hemoglobin. Remember this is less than 5%. Today I discuss about the hereditary hemoglobin disorders. There are 2 diseases here. Only there are 2 diseases. One is thalassemia and another one is hemoglobinopathies. Now first time you should know what is thalassemia. Thalassemia may be defined as deficient or absent production of the polypeptide chain. And what is hemoglobinopathies? Hemoglobinopathies, it is a quality defect of the hemoglobin. That is there is a alteration of the amino acid sequence in the hemoglobin structure. This is known as hemoglobinopathies. There are 4 types of hemoglobinopathies. One is hemoglobin S, hemoglobin C, hemoglobin E, and hemoglobin D. Punjab. Remember this one. Now the thalassemia. Thalassemia is also genetic disease. It is due to the absent or deficient production of the polypeptide chain. Remember this one. Then thalassemia in our country, the hemoglobin disorder or hereditary hemoglobin disorder is most commonest disease in the Middle East, Southeast Asia, and around the side of the Mediterranean Sea. It's very much common around the side of the Mediterranean Sea, then Middle East, then Southeast Asian region. Remember this. Now what is thalassemia? I already told the definition of the thalassemia. Now what are the types of the hereditary hemoglobin disorders? How many types of the hereditary hemoglobin disorder? Number 1, you should understand the beta thalassemia. Number 1 is beta thalassemia. Number 2, hemoglobin E disease. Number 3, E beta thalassemia. There are 3 types of hereditary hemoglobin disorder. One is beta thalassemia. Another one is hemoglobin E disease. Another one is E beta thalassemia. Remember this. Again, this is again a subdivision. Again, there is subdivision. Now, first I like to highlight about the beta thalassemia. Beta thalassemia have got 3 types. One is beta thalassemia major, then beta thalassemia intermediate, then beta thalassemia minor. Minor is always carrier state. Minor is always carrier state. Just only one defective gene. Only one defective gene he or she get from his parents. But in thalassemia major, intermediate, it is homozygous form. There are 2 genes. The 2 genes from the parents are defective. This is called homozygous form. But minor it is heterozygous form. Only one defective gene in the body. Remember this one. Now what is hemoglobin E disease? Hemoglobin E disease, hemoglobin E means this is hemoglobinopathies. That is This is alteration of the amino acids, alteration of the amino acid sequence in the hemoglobin chain. Remember this. Now, what is hemoglobin A? The substitution of the glutamic acid by lysine at the 6th position of the hemoglobin chain. Look here, box. Look here, box. What is hemoglobin A? What is hemoglobin S? This is a substitution of the glutamic acid by valine at 6th position of the hemoglobin structure. Remember this one. Now, what is the hemoglobin C? Hemoglobin C is substitution of the glutamic acid by lysine at 6th position of the hemoglobin chain. Remember this. Now, what the clinical manifestation? Clinical manifestation, everybody knows. Progressive failure, jaundice, and hepatosplenomegaly. What is the cardinal feature of the thalassemia? What is the cardinal feature of the thalassemia? Progressive failure, jaundice, and then hepatosplenomegaly. This is the clinical manifestation. Now, what are the investigation? Investigation is complete blood count with peripheral blood film and red cell indices. You should know. Then you go for another one is that is osmotic facility test. Osmotic facility test is reduced facility. Remember this one. Next one is hemoglobin electrophoresis is the confirmative diagnosis of the thalassemia. Remember this. The hemoglobin electrophoresis is the confirmative tools of diagnosis of the thalassemia. Next come what is the management? Management, just supportive management and specific management. Supportive management and specific management. Supportive management is blood transfusion. There is chelation and blood transfusion therapy. Number 2, if they be enlarged big spleen, then there is splenectomy. And there is so gamma cell induction. Gamma cell induction. This is the supportive treatment. Now, what is the specific treatment? Specific treatment is bone marrow transplantation and gene therapy. Remember this. Remember this. This is all about. Next, what is the parents' counseling? Then only the parents' counsel. How to prevent the thalassemia? How to prevent the thalassemia in the world? No thalassemia patient is not coming at the world rest time. How to prevent? Prevention is first of all you should detection of carrier detection. Carrier detection. And discourage the marriage between the two carrier. Remember this. How to prevent the thalassemia? First of all, carrier detection. Number 2, discourage the marriage between the two carrier. Remember this. This is all about. Thank you very much for patient hearing. Now you